I'm Dushyant Sahani, professor of radiology, and I will share with you how I use spectral CT in the assessment of patients with known or suspected pancreatic mass. Pancreatic lesions is a real challenge. Majority of patients might present late if there is a pancreatic cancer, and our job is to stage those patients. But also, there might be incidental findings that we might have to both detect and characterize because ramifications for managing pancreatic lesions is huge. So, being accurate in our assessment is critical. More importantly, the referring physicians rely heavily on the report we provide from CT images in making a decision on patient management. I also want to emphasize that CT is the modality of choice in the assessment of pancreas. So typically, we get a dual phase acquisition. I will show my hanging protocol here. On the left side is the arterial phase monochromatic images reconstructed in a soft tissue kernel using 55 keV images. This gives a high soft tissue contrast between the lesion and the background. On the right side, I have the portal venous phase images reconstructed in a 70 keV in the soft tissue kernel. On the bottom left is the coronal venous phase images reconstructed at 70 keV. And on the bottom right is the material density iodine axial images. So let's start. We have to go through the upper part of the abdomen. Here we go through the liver. First thing we notice, there is some heterogeneity in the liver. And as you can see, the patient is larger in size. And therefore, sometime we might see some beam hardening artifact. After you have reviewed few of these cases, it becomes very clear this is artifactual. It's not a real finding. We go and look for pancreas. Here, this is the body of the pancreas. This pancreas is slightly atrophied. There is heterogeneity. We trace the pancreas. We see additional heterogeneity in the pancreas and volume loss. Now I can see pancreatic duct in the center of my image. I'll follow the pancreatic duct. It leads to even more heterogeneity. Now we are in the region of the neck and head of the pancreas. And as we go towards the head and uncinate process, we see a clear mass and its relationship to the vascular structure, that is the superior mesenteric vein. Here, this is the first branch of the superior mesenteric vein, and we can see the hypodensity in the pancreas is wrapping around partially the superior mesenteric vein branch. Now, what's the beauty of the monochromatic images here? You can get the true definition of the lesion in the normal pancreatic parenchyma. We go down, we continue to see the lesion. Now, we see the duodenum come in the image. Now, on the axial images, it appears this mass might be invading in the duodenum, which is an important information I need to provide my oncology colleagues. Let's go to the venous phase images just to make sure that the veins are fully opacified, which indeed they are. We confirm the lesion and its relationship to the superior mesenteric vein branch. That's an important information I need to provide. I'm looking for any metastases like lymph nodes in the vicinity of the pancreas. Now I will go and look at the liver. We'll start from the top. I see heterogeneity that I mentioned earlier. We come down to the left lobe of liver. I noticed there is a low density area. Now that is an important finding. We need to classify this into benign or malignant. In an event I have a doubt about this lesion, this patient might require MRI, because if there is metastasis to the liver, the only treatment option for pancreatic cancer patient is chemotherapy. So I will interrogate this lesion again with additional images. We'll go and look at the coronal images again. Now, coronal images, I'm trying to not only look at the lesion in the pancreas, its relationship to the organs in the vicinity, like this superior mesenteric vein and its branch, and I noticed there is abutment of the vein, no clear encasement. And I also confirmed there is partial invasion in the medial wall of the duodenum. I'm looking for any peritoneal disease, and I did not appreciate anything obvious that raises my concern for metastasis. Now, let's go back and look at the lesion on the material density iodine images. The way I use the material density iodine images as a last layer to screen not only for the lesion in confirming the finding, but anything additional. Let's go to the liver lesion here. Now, what we notice, the liver lesion is not showing either a rim enhancement or heterogeneity within. That would have raised my concern for metastasis. Having not seen that, I feel confident this is an incidental benign finding like focal fatty infiltration, and I'm not going to order MRI in this patient. So I look for anything additional. I did not observe that. So if I put everything together, this is a great example of how spectral CT images can be used. Uh, I see a focal mass in the pancreas. We confirmed its partial involvement of the superior mesenteric vein branch, and there is lack of metastasis. The incidental lesion in the liver, we believe, is not metastasis. This is a focal fatty infiltration. We don't have to order any additional tests for this patient. And this is how I use spectral CT in my practice for the assessment of patients with known or suspected pancreatic mass.